90% of the adult population have periodontal disease. And that is not our fault. That's infectious disease. And it's not an epidemic, it's a pandemic. And that means everybody has it. And when you do DNA testing, you find that the bugs are either your mother's, your lover's, or the dog. So don't you love DNA testing? And Bowser, don't put your tongue on my face. So that the therapies that have been adopted for periodontal disease have changed remarkably in the last 50 years. In my grandfather's time and in the medical practices clear back in the 18th century, 19th century, they would paint the gums with stuff like ginseng violet or zinc chloride or silver nitrate to what they thought was, heal the gums, but basically they were killing bugs. And now we know that, bugs aren't that hard to kill. And so there are a lot of better ways to kill bugs. And so they will be talking about that. One of the people that I really appreciate for his courage and his willingness to reach out to the dental profession is a guy named Bob Barkley. Is that Dr. Barkley somehow, and I don't know how, was allowed to talk to an all-student assembly at the University of Missouri at Kansas City, where I was going to school. I was a freshman. And so this is like, the second month we were in school. And so Dr. Barkley was talking to the 400 and some odd students that were gathered there, and he talked about the caveman dentist and how the caveman Thor had found a rock that was kind of a curvaceous, and he called it his dentalese rock. And that when Zog came over with a terrible toothache, that Thor said, have a seat on my dentalese rock here. And then he picked a large rock up and he said, hey, isn't that a saber-toothed tiger? And when the guy looked over that way, he hit him up the side of the head with the rock, knocked 4 or 5 teeth out. And Bob says the only difference between Dr. Thor then and now is we usually get them one at a time. Prevention means that you identify the cause, treat it, and look and see if it's gone. Well, that sounds like an interesting concept. Who came up with that? Well, that would be somebody named W.D. Miller 100 years ago. W.D. also went to the same dental school as my granddad, and the University of Pennsylvania, but he was about 20 years earlier. And he came up with the idea that tooth decay is an infectious disease. Some of the other people we'll be talking about are Charles C. Bass. Everybody knows the Bass brushing technique today. Important that Dr. Bass was an MD, not a dentist. Paul Keyes received a prize in 1960 as a researcher for the National Institute of Dental Research. And what was his prize for? His prize was for discovering the organisms that most likely cause tooth decay. Streptococcus mutans and a little bit Lactobacillus acidophilus. But so he was a well-respected, fantastic researcher until he also found the organisms that cause gum disease, and then he's an idiot. So WD stands for Willoughby Dayton Miller. He basically wrote the book about microorganisms of the human mouth, and that it hasn't changed much since. That they're still there, and that therapy should be aimed at improving the oral flora of the mouth as opposed to removing teeth, cutting off gums, drilling holes, stuffing mercury in, and that sort of stuff. Charles Bass was the first person to carry a microscope west of the Mississippi. So it's quite a while back. He was the youngest dean of a medical school ever. I think he was 27 years old, became dean of Tulane School of Medicine. He began researching periodontal disease shortly after the turn of the century, and he kept trying to tell the American Dollar Association about it, but they weren't interested. They could care less, and they badmouthed him. So in PR, the way you address controversy is that you first denigrate the source of the information. Oh, that Dr. Bass, he's an idiot. He's a bad quack. He's the youngest man to ever be the dean of a medical school and knows how to use a microscope. So you denigrate the person, then you denigrate their information. He's not a dentist, he's a physician. What's he know about the mouth? He's all wrong. We know germs have nothing to do with gum disease. And then you cite authority. And besides, the ADA recommends that you use the Stillman's technique, which is where you brush down on the top teeth, up on the bottom teeth, because Dr. Stillman was a president of the American Dollar Association, and he knows how to stop tooth decay. Well, you'd think I was really mentally challenged if I was telling you the way you get dirt out from under your fingernails, you brush down on your finger, right? Well, that's what they were essentially saying. And, you know, it worked about as good as brushing down on your fingers. You know, it was a technique doomed to failure. And Bob Barkley went around talking about it and got everybody laughing. And one of the things that the fools can't stand is when people laugh at them. And so when everybody laughed at Dr. Barkley and brushing down on that, it's got to be the silliest thing ever. So in 1972, after Dr. Barkley made everybody laugh at them for a while, the ADA adopted both the Stillman and the Bass technique. So, you know, if you don't know what to do, say it's all good. So, anyway, most dental schools now are at least teaching the students something about the Bass technique. What's interesting about the Bass technique is that Dr. Bass did not just come up with it. He wasn't just sitting in the bathtub one day and say, you know, I think we ought to aim the brush at the gum. He did a whole series of experiments with dental floss, with the Bass brush, with an oral irrigator, with his microscope. He didn't come at this by looking at his mouth and seeing whether his gums were pink or bleed or not. He looked at the microorganisms that were present with a microscope. So he could evaluate within a matter of seconds whether this was effective or not. And that's how he came up with the idea that if you're going to go get the gook out of the gums, you got to put the toothbrush toward the gums. If you're going to get the brush in between the gums, you have to pull out. And he started with things like the Oral-B 60 and ground off about a third of it, and he pulled out 2/3 of the bristles and polished the ends and all that to create the Bass brush. I've just given you a copy of the Bass brush. It's made by one company in the United States. It's called POH for Personal Oral Hygiene. How did they come to make that was that the owner of that company was a periodontist, a dentist in Tulsa. And he had contacted Dr. Bass and had learned from Dr. Bass that you need to be pointing the brush at the gum. And Dr. Bass was making his own brushes. And so he bought the equipment and started a toothbrush company so he could have brushes for his practice. And I buy these, and these are my gift to you. And they're about 50 cents a piece. They're not bad. And if you're the United States Navy, you can get them for 10 cents. But the reason that I give this to you is because unless you've done the Bass technique of brushing with the Bass brush, you have no idea what Dr. Bass was talking about. And I give this example is that if you were unemployed, say for instance the dental business went and kind of in the tank and you decided you were going to read through the want ads, and here's they want somebody to lie on a bed of nails at the circus. And so you went to apply for the lying on the bed of nails job, and you got there and they had the bed, but it only had one nail. You wouldn't like that job. But if it had as many nails as an Oral-B 60, you could boogaloo on that. It wouldn't bother you a bit, you know, because it has enough pressure points that it would support your body. Well, that's what Dr. Bass understood. You need to remove the pressure points on a brush so that when you aim it at the gums, the bristles will divide and go in between the teeth. So all of a sudden now you're brushing where you're arguing at patients about flossing. If you can see gook on somebody's teeth, it's not a floss problem. It's a brush problem because the floss is only the last little bit of gook that's hidden in between the teeth because you can brush away all visible plaque with a Bass technique of brushing. And I actually demonstrated that for one lady who was selling Rhododendron. She said, oh, you can't do that. And I said, want to watch me? I had a lady came into my practice one time from a periodontist in San Francisco, and she was looking for a good dentist and had heard that there was something about my practice that might please her. And I was curious as to how she was controlling her plaque, because when you look at her teeth, she obviously had terrible periodontal disease at one point in time. But when I looked at her mouth, it was perfectly healthy. There's no bleeding gums. The gums were tight and snug, and teeth were solid, and the exposed roots were all polished and shiny and all that stuff. And she says, well, I use gum grooving. And I said, gum grooving? I don't believe I'm familiar with gum grooving. And so she immediately whipped a toothpick out of her pocket, broke it so that it was only about 3/4 of an inch long, and she took the tip of the toothpick and stuck it down in her gum and scraped around the neck of each tooth, got up in between the teeth and rubbed it. And she said, can you hear it squeak? I can. And she said, you rub it till it squeaks. And she went around with that little piece of toothpick in her fingers around every single tooth in her head. And when you look in there, there was no plaque. When I looked under the microscope, there were no pathogenic microorganisms. So I say, if she can do it with a little stick of wood, then the rest of us are just whiners, because we have all sorts of nice tools. We don't have to use a little stick of wood. But there are handles that you can hold the toothpick with, if you like. You know, Perio aids is what they're called, or the back end of a gum brush. But that's not the problem. Plaque, visible plaque, is not what causes gum disease. And I'll show you a movie in just a little bit about what causes gum disease, and I'll tell you, they're all swimmers. They're fish. They're not marbles that sit still. They're fish that swim away when you try to get them. And you go, whoa, this is an alive microorganism, and it's smart. It actually organizes itself. It creates colonies. It creates the spirochete will actually create a spirochetal pump, and that it'll take some not very fast organism, say, hey, you, I want to use you. And then they line up on it like a row, and then they beat in a rhythm so they can create a circulation. So when bacteria start building their own heart so they can eat more of you, you're in trouble. But the good news is it's fairly easy to kill them.
This is an animation of what you're about to see in this patient's bacterial smear. This is a white blood cell, your body's defense system. It's a neutrophil with a multi-segmented nucleus. The cytoplasm of the white blood cell appears to effervesce or boil. That characteristic distinguishes the white blood cell from the really bad actors, amoebas. In this smear, there's an army of white blood cells forming a barrier. White blood cells always work together to try to protect you, but they're helpless against the amoeba. This is a large amoeba. It is a one-celled animal and a parasite. It's often found in severe periodontal infections. It's about to give birth. This is the nucleus. The white spot is called a vacuole. The cytoplasm does not effervesce. They move by what's called a pseudopod, or in other words, this blob bulges out in one direction or another, and it slinks that direction. This one will take a nucleus and a cytoplasm and make a whole new amoeba. This is the only video I've seen of an amoeba giving birth. Spirochetes are virulent bacteria. Every species we know causes some terrible disease of mankind. Syphilis, Lyme's disease, ehrlichiosis, or gum disease, just to name a few. They move rapidly with a wriggling motion, which makes them easy to see on the microscope. They look like snakes. They can go in either direction, and unlike most other bacteria, they can bite. They can actually penetrate mucosa, and I've seen them bite their way inside a red blood cell. They live in the crevicular fluid around teeth and also in the bloodstream. They are a very bad bacteria to have, but fortunately they're easy to kill. They can't even stand oxygen because they're anaerobes. Salt or baking soda will kill them as well as a whole host of antiseptics. In my practice, I use the spirochete as a barometer of the patient's home care and also my own hygiene department. After a normal cleaning, both at home and in the office, there should be no active spirochetes. In the center of the screen, there are two skin cells, and between the two large cells is a white blood cell being attacked by a mass of spirochetes. Spirochetes show group intelligence and will actually attack your immune system. They have the ability to penetrate mucosa. This is called organization. When you see organization, you know the infection has been going on undisturbed for some time. Thus, home hygiene is inadequate. It usually takes several days for them to become organized. Spirochetes show group intelligence. You do not want smart bacteria. Here they have ganged up on a white blood cell. When you take the bacterial sample from the patient, you'll see thousands of spirochetes, all biting a white blood cell. This shows organization. When they get too crowded, they'll all line up on one of the non-motile rods and begin to beat together and make a heartbeat. So they create their own circulation and pack more spirochetes into a smaller area. This smear is almost to that level. When Trevor Lyon first lectured to this academy about the role of amoeba in periodontal disease, I was very impressed. On the following Monday, when I returned to my office, I met a new patient concerned about her rapidly advancing gum disease. What you will see is a short clip of the microscopic sample I took that day. This animation explains what you will be seeing. You recognize the amoeba and the white blood cell. The amoeba appears to stick a snorkel into the nucleus of the white blood cell, and almost immediately the nucleus appears to dissolve and migrate through the snorkel into the body of the amoeba. The white blood cell dies, but in doing so, it will release histamine, which will call millions more white blood cells to the area. More food for the amoeba. Biocompatible Perio is where you identify the cause of the problem and disinfect the mouth or kill a one-celled animal, amoeba or trichomonads. So it's a lifelong service as long as you don't become reinfected. So you get your mouth checked periodically and the mouths of your spouse and loved ones. So it's a human host pathogen. It goes from person to person. There's no surgery involved. It's merely a question of identifying the cause and killing it, and then making sure that it doesn't come back. It's a very simple, safe procedure. Strongly recommended.
One of the things that I'd like to show you is a historical perspective of this. This is not a new problem. The gum disease has been a problem for mankind for tens of thousands of years. And that it's a microorganisms, and so here's a fellow that lived in the San Diego area, and that you can see that they ate a diet of acorn, and the acorns wear teeth down, and so you can see how the nose and the chin are coming together pretty good, and the teeth are worn out to smithereens, and when you look at the lower teeth, they're worn down to nubbins. You can see this in the center of each tooth, there's where the pulp canal has receded, and these teeth are probably vital. But the teeth have basically worn down to smithereens. You can also see that the bone has left all the posterior teeth. And so when you're going around with the perio probe, you're taking a sharp metal instrument, pushing it through an area of infection, and poking it down into the bone. That's called seeding the bone, so the disease goes on more rapidly and advances faster. It's really good for business. It's very bad if you wanted really to save the teeth. So I did a periodontal chart on every patient every year after we disinfected the gums. There's absolutely no reason to take a sharp metal instrument and poke at the gums when there's infection there. If you had an infected finger and you went to the doctor and she picked up a blunt needle and poked at the infection about 6 times, said, "Yep, that's a hole in your finger, all right," you'd get a new doctor. So bone loss is the problem. It's not really gum disease, it's bone disease. And so that's what that looks like with no skin. That's what it looks like with skin. And what's causing it are these little things here. If you look, they're wriggling and carrying on and having a good time. And that is basically a spirochete. There's a red blood cell in the center. We'll have a better view of this in a minute. This is a phase contrast microscope. These microorganisms are clear, so under a light microscope you get kind of an idea. It looks like you got fuzzy stuff in your eyeballs or something, but that they are wrigglers. They look like snakes, and they're not the good ones. Anything that's benign is sitting still, and so if it's not sitting still, then you want to kill it. So it's not rocket science. This is that same guy that I was showing you earlier, that on the upper teeth that actually worn into the pulp canal, and the front teeth wore out faster than the back teeth. But the back teeth are lost more rapidly than the front teeth, and that's because of the bone. The density of the bone on the maxilla is less than the mandible, and so typically you lose the posterior maxillary first. And that, you know, the reason for the excessive wear in these people was because they were eating stone ground acorns. And so there's a little bit of granite in the acorn that if you grind it up with a stone, and that's a real tough food to chew, and the vegetarian, though, it's very nice. Here's a tooth that was worn into the nerve and became non-vital. Here's the youngest skull I looked at. These are all in the Museum of Man in San Diego. Rose Tyson was kind enough to dig through the boxes in her office and show me some representative examples. And she first looked at this fellow's skeleton, and she said, "It's a girl." And I said, "Well, it's a pretty ugly girl if it is." And then so she looked at the pelvis, and she said, no, it's a man, but it's a little bitty guy. And he's only about 4 feet tall. And she looked at his bones, at the femur, and she said, "It looks like he was injured and became ill about age 12, and then got a little better and then worse, a little better and worse, and then died." And she estimated his age at about 21. He had all 32 teeth, and you notice no orthodontics? You don't see any braces, do you? So the crooked teeth is a symptom of our fluoride exposure. In China, the only place we saw crooked teeth was in the high fluoride area. All the kids in the non-fluoride area had perfect rows of straight teeth, all 32, if they were 18 or older. And so when the dentists say, "Oh, I haven't noticed any problem with fluoridation," you say, "Have you noticed that there's an orthodontist on every corner?" And what's that got to do with it? And so anyway, when you took the skull apart and looked at the maxilla, you can see that the one side is extremely worn and the other side is not. And so we examined this a little more carefully and noticed that there was an abscess, a pretty good substantial abscess, where he'd worn into the pulp. And that if you look and see why he only ate on one side, is that the TMJ was actually fused to the socket on the contralateral side. And so he apparently injured his jaw when he was 12 and then couldn't eat. It only ate by gnawing, and that when he wore out that tooth, he starved to death. So teeth are a measure of longevity in many ways, and that fortunately now that we have McDonald's, we can eat with our lips. We no longer need teeth. In that same tribe, there was the fellow that lived to be the old man in the tribe, and you consider this is 500 years ago with no medical treatment except for the guy with the feathers and the chanting. Pretty good age to live to be 60, and an average life expectancy in Europe at the time was in the 30s. So, and so we started looking at this specimen that I asked her. I said, "Did you clean this guy's teeth or something?" She said, "No, this is just like we found it, except we wrote San Diego Museum 718 to be able to identify where it came from." And I said, "What can you tell me about it?" She says, "Well, see how the front teeth don't completely touch on the lower?" She said, "That means that he was using those teeth to either strip a reed to weave it into a basket, or to make an arrow, use the leather to make an arrowhead." And I said, I'm going to vote for basket. The reason being is, see how shiny the teeth are? Is that business wasn't that good. So he would sit there with his little wooden stick and stick in between his teeth. And that's how he got to be. If he'd had a crooked stick, he could have saved those back teeth. Because that nice lady from San Francisco I was telling you about in my practice that took the little piece of toothpick, she got back behind her second molar. So he could have probably saved those back teeth if he could have gotten back in there and got those all those little gook off his teeth. The fuzzy stuff on the teeth is not what causes gum disease, but it is part of what allows gum disease to progress. because it coats the gums, gingiva, roots, and uses up the oxygen so that there's an anaerobic condition below that. And that's where the periodontal disease thrives. So it's not really this caused that and that caused this. It's they together in a sensation work to cause disease in your mouth. And the solution is to kill them. Questions to ponder. Do you notice any orthodontic problems with humans from the past? Crooked teeth never existed. Occasionally you would get a caveman with a buccal version cuspid or a impacted wisdom tooth, but you know, what do we got? 80% of the kids today can't get all their teeth in their mouth. That's a growth and development problem. And it's likely that growth and development problems may be associated with growth and development inhibitors such as fluoride, and that if you have growth and development problems with your teeth, do you have growth and development problems with your brain? Perhaps. So the present paradigm is that scaling, antibiotics, disinfectant, oral hygiene instruction, and surgery. And one of the things I learned from my mentor, Bob Barkley, is that if your oral hygiene instruction occurs in the presence of a pointing finger and the words should, ought to, and must, you are following into the role of the parent. And in the book, there's I'm okay, you're okay. It's called transactional analysis. And that as a doctor, when you put on a white coat, you fall into the parent role. And that the thing about parents is that if they can't see how fast you're driving, then you drive however fast you want to, because the parental role requires reinforcement. And so if you want the kid home by 10, you got to be up there standing by the door at 10 and saying, are you in the door? And that's you should be home by 10. You must be home by 10. You ought to be home by 10. So that's the parent role. The trouble with the parent role is that it's never going to work for any great length of time. You know, your parents told you not to do that, and you're doing it. So that's what happens with parent roles. On the other hand, if you empower the patient to be successful or fail, then you are adult communication. And I'm not saying partner, you're not their friend, you're their advisor, and you are offering them a fork in the road. And what it is if I were you, and so the words might, can, able, empower the patient. If we empower people to get rid of disease and become healthy, then all of a sudden they're a lot more willing to send people to your practice. They're a lot more willing to join because they don't want to be children. They don't want you wagging their finger at it. They don't want the hygienist yelling at them. They want to be empowered. They enjoy it. They seek it out. And that becomes a magnet to your practice. It became a magnet to mine. That was the engine that could. It just drove people from actually all over the United States into my practice. So consumer trends and desires, they're green, natural, integrative, self-administered, non-surgical, non-pharmaceutical, non-toxic. Isn't that what everybody's asking for? Well, that's what come to my practice for.